Alright guys, let's discuss about the knee joint. Knee joint is one of the major synovial complex joint. Why this is called as complex joint? Because there are a lot of structures inside the knee joint. As you can see that actually we have removed the patella here, the kneecap, and inside you can see the menisci also and a lot of ligaments also, and the articulation of the condyles of the femur alongside the tibia also. So this is one of the major joint, and it's having some structures like menisci also, which are acting as shock absorber in the knee joint. So we should understand that this is basically one of the major synovial hinge joint also, and there are two basically menisci there also. One of them is the medial meniscus here, and one of them is the lateral meniscus also. So actually there are some strong collaterals also which help in abnormal outward and inward dislocation of the knee joint. As you can see, the lateral collateral ligaments, and on medial side you have got medial collateral ligaments also. And here you can see that medial meniscus is strongly attached with the medial collateral ligament, and there is no attachment on the lateral side of the lateral collateral ligament, which lateral meniscus. So this is clinically very important. And then you should understand that there are cruciate ligaments also, which are attached from posterior part of the femur to the anterior side of the tibia. You can see X type, you can see here anterior and posterior cruciate ligaments. So these are important ligaments because anterior cruciate ligament, it prevent anterior dislocation of the tibia. So posterior cruciate ligament prevent posterior dislocation of tibia. So any injury to anterior cruciate ligament, which is one of the most common ruptured ligament at the knee joint. So any injury to the anterior cruciate ligament, it means that if you will push the tibia on the anterior side, there will be dislocation of tibia at the anterior side. So this is called as anterior drawer sign. Anterior drawer sign. So anterior drawer sign is positive in case of injury to ACL ligament, which is commonly ruptured ligament, and especially it's commonly ruptured in athletes. So you should understand, please. Then if there is injury to the posterior cruciate ligament, and if you are pushing tibia on the posterior side, or if you will bend your knee, it means tibia is slightly gliding posteriorly. So posterior dislocation of tibia, it means there is injury to the PCL ligament, posterior cruciate ligament, and it means the posterior drawer sign is positive. So ACL tear, anterior drawer sign is positive, PCL tear that you are pushing tibia and it's moving posteriorly, so it means there is injury to the posterior cruciate ligament. So posterior drawer sign and then anterior drawer sign, you should understand. Then you see any injury, as you can see on the lateral side, this is the fibula bone, and this is the head and neck of the fibula. On the medial side you can see the tibia. So suppose this is the right knee joint. Now if you have got any injury from the outer aspect of the knee joint from the lateral side, it may lead to injuries inside the knee joint on the medial side, because you should understand normally you can flex your knee joint, and this is basically function of the biceps femoris or the hamstring muscles, which are attached in the posterior side of thigh bone, and extension of the knee joint. When you kick football, it means you are using anterior part of the thigh muscles like quadriceps groups. And you should understand that actually if you have got any injury on the outer aspect of the knee joint, it may lead to abnormal abduction of the leg at the knee joint. Abduction of the leg. So abduction of the leg actually is limited by medial collateral ligament. So if you will have strong force coming from the outer aspect of the knee joint, it may lead to injury of the medial collateral ligament, and as medial collateral is attached with the medial meniscus, so that's why in case of strong force coming from outer aspect of the knee joint from the lateral aspect, it may lead to rupture of medial collateral ligament alongside the medial meniscus. So you should understand it, please. Secondly, you should understand there are three common structures commonly ruptured at the knee joint. Like most common injury is the injury of the anterior cruciate ligament, then there is injury of medial meniscus, and then there is injury of medial collateral ligament. So you should remember like MMA. So this is called as unhappy triad of knee joint. Unhappy triad of knee joint. triad of knee joint. So there are three structures which are commonly injured at the knee joint, like medial collateral ligament, medial meniscus, and then anterior cruciate ligament. So any injury to the outer aspect, there will be abduction of the leg at the knee joint. It's mean it's applying a lot of force on these structures, so it may lead to injury and rupture of these ligaments. I will show you another structure. So here you can see, okay, as you can see here, like suppose this is anterior view of the left knee. Here you can see the fibula is on the lateral side. This is fibula, this is your tibia, here is fibula. So this is the force coming from the lateral side. Here is the lateral collateral ligament. Focus here please. The force is coming from the outer aspect. Now this abnormal movement is basically the abduction of the leg. You see the leg is coming outside. So this is called as abduction of leg at the knee joint. So who is going to limit this movement? The structures on the medial side. So you see the force. So it lead to injury of, you see, injury, tear of the medial collateral ligament, tear of the medial meniscus also, and it may lead to tear of the anterior cruciate ligament also. So it's really important to understand that abduction of the leg at the knee joint is limited by structures like medial collateral ligament, and medial collateral ligament is strongly attached with the medial meniscus. That's why any force coming from outer aspect, it might be due to the road traffic accidents also, or any sport injuries. So that time you will have injury to all the structures like medial meniscus and then medial collateral ligament, or it may lead to injury of the anterior cruciate ligament. Thank you for your concentration.